Welcome to the Digital Health Pulse. I'm Trevor Yasinow. Let's jump into today's conversation. Hi, everyone. Welcome to another episode of the Digital Health Pulse video series with myself, Trevor Yasinow. I am joined today by Ty Arlint, Chief Revenue Officer at PeopleOne Health. Welcome, Ty.
Hi, Trevor. Thanks for inviting me. I'm happy to be here.
Happy to have you. So, Ty, you've been in this digital health space, geez, probably the past 7 or 8 years, been in sales the past 20 something years, and have seen some amazing companies grow and take off. Now, to see you join a company like PeopleOne Health, they must obviously be doing some right things. So, with that being said, my first question for you is, can you tell me more about PeopleOne Health?
Yeah, absolutely. Thanks, Trevor. PeopleOne Health is it's a really unique opportunity for me and the timing to be joining. Really at the baseline of what we are is we're a value-based advanced primary care company, and so what we do is our goal is to remove all the financial and physical barriers for members getting health. Right, so we've got health locations, brick and mortar, and we also bring in the telemedicine component to it. And we give members the service that they need from a concierge level medical perspective, right? So we help guide them through their entire course of care with a major focus around preventative medicine. As you know, today, the population in the US just is continuing to get sicker and sicker. There's a lot of comorbidities, and people are putting off care because they can't afford it. And the longer they put care off, the worse it gets, and eventually they end up in an ER or an urgent care, and they're dealing with multiple symptoms. And so our real goal at PeopleOne Health is to remove those barriers, get people the need or the care that they need when they need it, and make it far more accessible than it is today.
Very helpful. And it seems like such a cost-effective solution. So, how are you getting it in the hands of all employees?
Yeah, so it's a great question. Ultimately, there's studies out there that say, up to or close to 50% of the population that has health insurance
Mhm.
through their employer, that pay for their insurance out of their paychecks every week or every month, is functionally uninsured. And really what that means is they've got an insurance card, it sits in their wallet, but when it comes time to use it, because of copays, co-insurance, high out-of-pocket costs, and deductibles, they choose to put care off, because the question becomes, well, do I put food on the table for my family, or do I go deal with what I've got to be dealt with? And because the costs are so high, oftentimes they delay care, and then bad things happen, right? So what we're doing is we are working with employers, partnering with them to offer a benefit it's employer sponsored, so they pay for it for their members. So the members have free access to our health centers. It's a voluntary program. All they got to do is raise their hand, and they can change their primary care provider if they have one, which, as you know, probably most people don't have a primary care physician. So they raise their hand, they elect one of our locations to be their primary care home base. And then they've got unlimited access to come see us anytime they want. We typically offer same day, next day appointments, guaranteed. So if somebody has something that they need, we remove that barrier from an access perspective, and then we put a plan together. We work with them on, what they want to try to accomplish and achieve, and that's when the program starts. So, we do a really good job of partnering with the employers that we work with on building a marketing strategy and a marketing plan to help people be aware of the benefit and how they sign up. And then once they get in, they have such a great experience that they start telling their friends, and it just
It's
grows
awesome.
from there.
So, with the company, what makes it necessarily unique compared to others in the industry? Any competitors? It seems a little different. I just would love to hear more.
Yeah, I think really what makes us unique is what we're trying to accomplish for members is we're bringing their physical health, bringing their mental health, and their well-being all together under one roof with a care team. So every one of our locations has a primary care physician, we have registered dietitians, we have health coaches, we have licensed clinical social workers, we've got clinical pharmacists. And so what we're really trying to do is get that person surrounded with everything they need and start planning for the future. Oftentimes today, when somebody goes into a primary care location, even if they can get an appointment, which most times they're 2, 3 weeks out, so they end up in urgent care or ER, but they're going in, and rather than diagnosing the root cause of what's happening, they're getting a quick fix. They're getting a prescription written, and they get ushered out. They typically get 7, 8, 9 minutes maybe with their doctor. And they walk out with a prescription with no next steps. And what's unique about us is our appointments are typically anywhere from 30 to 60 minutes. Our care team takes the time to get to know the patient, understand their background, the challenges they've been working with, their family health, and really, tries to understand what they've been dealing with and where they want to go, right? Like I always kind of liken it to, it's almost like going back to the future, right? When I grew up, I had a family practitioner who we called at any time throughout the day or the week. If there was a problem that came up, he knew us, our whole family, and we got that level of care. And in today's world, that just is non-existent, right? And so, what we're doing is we're bringing that back to the masses. And rather than, concierge medicine's been around for a long time for people who can afford it. And what we're doing is we're bringing it to a community-based atmosphere where everybody can afford it because their employer is paying for it, and it's free to the member. Unlimited access. They can come see us anytime, as often as they want.
So who are your primary customers? I know you talked about a little bit about employers and just want to understand how do they benefit from the solution?
Yeah, so our target audience is any self-insured plan, probably 5 to 700 employees or more, right? Largest customer today is a school district in Orlando that's got 35,000 members, and we've got employers that have 2, 3, 400 members, right? So we work for anyone, anytime. But the value that we bring is that on average, an organization that brings us in as an additional benefit to their health insurance plan, they're going to see typically around a 30% savings in claims reduction. And the win for the member is there's no out-of-pocket costs, there's no co-pays, no co-insurance, no deductibles, nothing has to be met. Because we're a value-based ecosystem, we've taken the fee-for-service model and flipped it on its head. And we include all those services in our model for one per member per month fee. So the members pay nothing ever for any of the services that we offer, and the employer sponsors the plan and they get a massive reduction as well. I think one thing that's really important to note is probably somewhere around 85 to 90% of the services that you typically would see hit your claims when a member goes into urgent care or ER get redirected into our value-based model, and they never hit the claims wire. And that's where the savings comes
Yeah,
from.
the claims savings, that's the immediate savings, year one. That's what's so important in this point solution world where we see a ton of point solution fatigue, right, from these CHROs, the benefit leader. So it makes a ton of sense. And that's the light bulb in their minds of seeing immediate savings. That's incredible.
100%.
And what
100%.
is one exciting trend you're seeing in digital health right now? It doesn't necessarily have to be this space, so to say, but just curious your thoughts.
Yeah, I mean, everybody's talking about AI, right? And what can AI do for us? And I think um, I'll play off that trend a little bit because I think, from an AI perspective, we're looking to leverage AI in the sense that AI can remove a lot of the administrative burden that happens within a health center, and it can free the care team up to spend more time with members and more time with patients, right? You think about a typical primary care or urgent care or ER scenario where somebody goes in, there's a ton of paperwork you got to fill out. The first thing you're given is a clipboard and say, I need to verify your information. It's like, well, I was in here 8 months ago and nothing's changed. Yeah, we need to fill it out anyway. All the things that have to happen, typically that happen in those offices, never happen in ours because we don't file claims and we don't work through fee for service, right? So we can leverage AI to continue to get more succinct in those areas and free our care team and our providers up to give more and more time with patients. And I think that's really exciting for us. I think there's a lot of different ways people are leveraging AI, and that's one of the ways I think that can really help our industry continue to put the focus back on the member and give them the time and attention they need.
So, my last question for you. What does the next year look like for PeopleOne Health? Any big goals or milestones on the horizon?
I mean, I'll just say continued growth, right? The market has really taken to our solution. Everybody that I talk to, what I typically hear from them is this sounds too good to be true. Like it's crazy. And, what I always respond to them with is, hey, if we can get some census data and some claims data, we can show you what that initial savings looks like. And we can show you from a heat map perspective how close your members are to our locations. And we can immediately start talking about the impact we can have on the organization. Towards the end of last year, we just wrapped up a Series B funding round led by Google Ventures for up to $32 million. So Google Ventures saw our model, heard it, listened to it, and said, this is the health plan of the future. This is the direction that organizations need to be looking at. So I think the sky's the limit for us. We've got tons of growth happening in Florida right now. It's probably our hottest market where we're having a ton of success, and we'll continue to build off that. We've got a few new markets that we're going to be leaning into in 25 as well, going into 26. So very exciting times. We're just growing like crazy and having a ton of success. So we're super excited to change the look and feel of healthcare and really bring this value-based model to the masses.
Well, Ty, it was great to learn more about what PeopleOne Health is doing in the digital health space today. I'm looking forward to see all the exciting things that the company will be doing, and obviously with you at the helm. So thank you so much for joining me today.
Absolutely. Thank you. Appreciate the invite, and looking forward to future conversations.
That's a wrap for this episode of the Digital Health Pulse. A huge thank you to my guest today. If you enjoyed this conversation, be sure to like, repost, share, and follow for more chats with the top innovators and leaders in digital health. Have a company you'd love to see featured? Drop a comment or reach out. Thanks for watching, and I'll see you in the next episode.